Hi, my name is Rohima Miah. I'm a psychiatrist in private practice in the Triangle area of North Carolina. I'm making this short video to discuss the challenges all of us have faced in this very unique year of 2020. The COVID pandemic has made a lot of changes for myself in my practice and also for my patients. I treat a lot of patients that struggle with depression, anxiety, the effects of social isolation and loneliness, and clearly the pandemic has exacerbated these concerns. I've moved my practice primarily to being online, which clearly has had some positive effects. Some of those positive effects have included being able to see patients that live further away from my office that they may have not been able to come in as easily. Patients with mobility issues have found it easier to be able to stay at home. Those who struggle from anxiety conditions sometimes find it easier, especially during their first appointments, to be able to be seen in their home. However, it also has exposed a lot of the inequities in our system. Some of my patients lost their jobs during this pandemic and as a result lost their health insurance and could no longer come in for appointments or felt they could not afford to come in and pay for their medications. Some patients also found that they didn't have access to the equipment like smartphones or computers or iPads or internet access that allowed them to do the telehealth appointments. So I think that this is the right time to talk about the need for a different healthcare system. A healthcare system that's not based on profit and based on the need to have a job. Our healthcare system does not have the possibility for people to have healthcare whether they're working or not working. Unlike many other countries where healthcare is paid for as a social and general good through taxes, ours is based on a for-profit system. And most people's insurance is part of the package of benefits they get at their job. Or for some people, it is insurance that is paid for by our government, including Medicare, Medicaid, those in the military through TRICARE, and who are government employees. I support Improved and Expanded Medicare for All system. I believe a system that is paid for by our taxes in a progressive tax system that provides coverage for every person living in the United States will eliminate a lot of the inequities we see in our system today. I think in this moment where many people have lost their insurance through losing their jobs, people that were not covered previously by not having the proper documentation to be living in this country, has exposed why we need an improved and expanded Medicare for All system. A system that would provide coverage to every person from cradle to grave. That would include, of course, covering mental health care, but also dental care, vision care, and long-term health care. In spite of the challenges we have all faced in 2020, I think there's much reason to hope. The tragic cases of George Floyd, Breonna Taylor, that has exposed the ongoing problems of police brutality in our country has sparked a movement in the streets where people are demanding that police be held accountable for their actions, and has brought together a large multiracial coalition of advocates for a system that values the lives of all of our citizens. One of the ways that we value lives is by providing good social services to all our citizens. The COVID pandemic has exposed the long-standing inequalities in our system, especially our healthcare system. Unfortunately, the COVID pandemic has affected poor people, working people, people in the Latinx, Black, and Indigenous communities to a much higher death rate and infection rate to COVID. Many of these workers did not have the luxury of working from home, and they were often our essential workers, not just workers that worked in our hospitals doing first line care like doctors and nurses, but also workers in the hospital that clean the rooms, that provide other services in our hospital facilities, but also workers in our grocery stores that pick and grow our food. Many of these essential workers did not have health insurance or inadequate health insurance. An improved and expanded Medicare for All system would eliminate these problems. This election year, we have also seen that many people support Medicare for All system. Unfortunately, our two major candidates are not supporters of a Medicare for All system. But I do believe that a strong grassroots movement can help whoever wins the next election realize that a better America starts with all of the residents of America having a good, comprehensive Medicare for All system. I hope those of you in the psychiatric field will join me in supporting Improved and Expanded Medicare for All, for ourselves, for our community, and for our patients. And I would like to end by just saying that I stand in support of Medicare for All, the Black Lives Matter movement, and a movement for social justice. Thank you.